Hey, Dr. Smith.
Good afternoon.
Hey, we have another question for a medical minute if you're ready for it.
Certainly. What's his question?
All right, we have a question from Joe, and Joe had the question, I've been told I'm having surgery in 2 weeks. What can I do to prepare?
So he's going to be having surgery in 2 weeks. Typically, if you're going to be having surgery, they're going to give you some information you should follow. So you need to follow that information. If it involves general anesthetic, then they may want you to see your primary care physician preoperatively to get clearance, because you need clearance to undergo general anesthetic, or maybe even a cardiologist, depending upon your age. And you need to follow those recommendations as far as keeping those appointments. And also they may give you some laboratory studies that you need to have carried out. For example, they may want you to have a chest film, EKG, laboratory studies. You can't really skip some of those things. Every now and then, I'll see somebody that shows up to have surgery done, and for example, they didn't do their urinalysis because they're sure they don't have a UTI. It doesn't work that way. Most of those laboratory studies are the policy of the hospital, the policy of anesthesia. You have to have those studies done, so you really can't skip any of those. Other important things are, if you smoke, you need to stop smoking. If you're going to be having general anesthetic, they put you completely to sleep, hence the name general. They also put a tube down in your lungs. When you're asleep, your lungs don't function normally. The machine is breathing for you, and all the fluids tend to pool up in the lungs and stuff, so you have difficulty clearing the lungs, and a smoker has more difficulty with that, and so they have difficulty waking up. They have a higher chance of infections post-operatively, so try to stop smoking, not only pre-operatively. It's a good idea just to stop anyway. Alcohol will usually be stopped a few days in advance because that does thin the blood and can lead to excess bleeding. Especially in spine surgery, bleeding can be bad because it can impinge upon the nerves, which could cause some weakness. And also bleeding into the muscle is one of the main reasons why people have pain after spine surgery. With minimally invasive spine surgery, we try to minimize the amount of bleeding, because if blood gets into the muscles, then the patient would have pain post-operatively. So anything that thins the blood should be stopped. Any blood thinning medications, aspirin, for example, affects the platelets, so you want to stop that. And many herbal medicines like ginkgo biloba act as blood thinners. So if you're taking any herbal medications, you want to stop those as well. And those are the main things. Keep your preoperative appointments, do your preoperative labs, stop smoking, stop drinking, stop having any fun whatsoever. No, I'm kidding. That's the main thing. And I think that answers the question. Have a good day. Hey, don't forget to subscribe.
Too close.